Welcome back to our channel. We provide you detailed information on medicines and drugs to help you inform your health. In today's video, we can talk about Skinlite Cream, coverage, uses, benefits, side effects, how to use and how it works. Let's get started. Manufactured by Zydus Català. Skinlite Cream. Uses. Skinlite Cream is used in the treatment of melasma, a condition that causes dark patches on the face. Melasma is commonly associated with sun exposure and hormonal factors. Benefits. Skinlite Cream helps improve melasma by reducing excess melanin formation and supporting skin cell turnover. These actions allow dark patches to fade more evenly and help improve the appearance of facial melasma. When used for short-term, intermittent treatment under medical supervision and combined with proper sun protection, Skinlite Cream can effectively improve melasma. Side effects. Like all medicines, Skinlite Cream may cause some side effects. Common side effects include application site reactions such as burning, irritation, itching, and redness. If these side effects persist or worsen, medical advice should be sought. How to use. Skinlite Cream is for external use only. Use it in the dose and duration advised by your doctor. Before applying, clean and dry the affected area. Apply the cream to the affected area and wash your hands afterward, unless the hands are the affected area. How it works. Skinlite Cream is a combination of 3 medicines: hydroquinone, mometasone, and tretinoin. Hydroquinone reduces excess melanin formation in the skin, helping to lighten dark patches. Mometasone is a corticosteroid that helps reduce inflammation, redness, and irritation associated with treatment. Tretinoin is a vitamin A derivative that promotes skin cell turnover, allowing melanin to disperse more evenly. Together, these medicines help improve the appearance of facial melasma when used for short-term, intermittent treatment under medical supervision.